a person who completes BDS from India, if they want to come to Australia, tell me what are the routes we have, what are the exams we have to write, and how long it will take.
Got my smile shining bright.
To come to Australia as a dentist, you have to finish your graduation here, and then you have to apply to APRA, which is the governing body in Australia for any.
Gnarly teeth.
You said documentation, so we need to give an eligibility certification and all that.
All the documents, there is a checklist. It
Checklist.
includes your degree, your hours that you've studied, your internship certificate.
All have to be sent online or to post.
Is her song.
For clinical examination, there are only nowadays they are conducted at least 2 to 3 times in a year. So each time they open.
Doc's in the chair, he's
Suppose my documents are clear, what are the textbooks I have to read? Like for UK, we read this Oxford's textbook of clinical dentistry. Is there any book which they generally ask from?
never coming back.
ADC is very difficult, but if you really want it, then there are pathways, there are people, there are academies that can help you, to prepare for written exam, to prepare for clinical exam.
Tooth fairy blues.
For people in India, I would suggest, there is a course provider in Chandigarh, there is a course provider in Delhi, Bombay. You can see whichever is close to you, you can go to them, learn.
Sings her song. With the dental doc, we can.
Hello, Dr Nisha.
Hello.
Welcome to
everybody.
Malligai Dental Academy.
Thank you.
We as a team, we like to thank you for your visit to Malligai Dental Academy. And as your fellow course mates are here, so we thought we'll have this discussion on the career options in Australia.
Yes.
Okay, first of all, a person who completes BDS from India, if they want to come to Australia, tell me what are the routes we have, what are the exams we have to write, and how long it will take. And if you give us the piece of information, it will be helpful for us.
Okay, so to come to Australia as a dentist, you have to finish your graduation here, and then you have to apply to APRA, which is the governing body in Australia for any medical or dental qualification, for an assessment. There is a whole checklist of documents that you will need to submit, and then they take anywhere from 4 to 12 weeks to assess your documents. And then say, okay, yes, you are eligible now to sit an exam. Okay, so in that process, if they need any document, they will ask you for that, or if everything is okay, then they will just give you the final assessment. Once the assessment is done, then you have to write a written examination, which is for which you have to prepare very thoroughly. They can ask questions from anywhere, from pharmacology, biomaterials, orthodontics, periodontics, all the subjects that you've studied from first year to 5 years. It's divided into 4 segments, and you have to do a multiple choice exam with them. Okay. Once you've cleared that step, then they will tell you you've passed or not, and then you have to sit a clinical examination, which you have to do in Australia. Until written examination, you can do it from anywhere in the world, but for clinical, you have to go to Australia and do it. For clinical examination, there are only nowadays they are conducted at least 2 to 3 times in a year. So each time they open a window online, you apply for it. If you're selected, then you're eligible to do a clinical exam. Okay. If you're not, then you have to wait another 3 months to sit for a clinical. Okay. In this process, your written exam is valid for 3 years, right? So if you can do dentistry, I always tell people, if you can do dentistry, you can do anything. ADC is very difficult, but if you really want it, then there are pathways, there are people, there are academies that can help you, to prepare for written exam, to prepare for clinical exam. Just like how Dr. Pravin is helping me, there are people who help you to pass written exam. There are people who guide you what to do in clinical exam, how to practice. What you need to do is be very motivated and have a tunnel vision at that time, that this is my goal and I have to reach it. If you have that attitude, ADC is nothing. Okay. So I encourage everybody, to at least try, if that is one of their dreams, whether it's Australia or New Zealand or Canada, or like Dr. Pravin is going for UK, to think beyond. Or if they want to do it in India, then learn. You're learning from such a good mentor. Make sure you utilize him fully. I only had 10 days. I told Abhi, at 24 she placed her first implant. That is such a lucky thing. I wish I had that opportunity. So the world is your oyster. Go do something big, make a name for yourself. Dentistry should not be just your job. If you love it, then there is no end to it. Love what you do. Okay. And if you ever have any questions regarding this pathway to become an Australian dentist, you can take my number from Dr. Pravin or Dr. Ananshya. I am available. You can WhatsApp me. I'm more than happy to help you in any way possible that I can.
Okay, I have few questions for this process thing. Okay.
Yeah.
You said documentation, so we need to give an eligibility certification and all that?
All the documents, there is a checklist. It includes your degree, your hours that you've studied, your internship certificate.
All have to be sent online or through post?
You can do it both ways, and they need certain attestations done through the notary. And they have it all written on the website. So the website to go to is AHPRA. That is the website. They have every little bit of information available for this pathway for an overseas trained dentist from India
So
to become
just
an eligible
quickly
dentist.
for the viewers, there are a lot of people who are watching this. They might be looking for the exact information. Suppose my documents are clear. What are the textbooks I have to read? Like for UK, we read this Oxford's textbook of clinical dentistry. Is there any book which they generally, ask from? Is there any concise books?
There is no particular book that is advised by APRA. What I suggest people is to take up a small course for a month or so. There are many course providers in Australia. If you Google course provider...
Is it online or offline?
It's online courses for theory exam preparation.
So they give notes and everything?
They give you everything, plus they also provide you with 10 years of past, questions and everything. And they help you solve those answers. There are many Facebook groups available. If you Facebook search ADC Prep Written Exam, there are multiple groups on Facebook that can help you. ADC Clinical Exam Preparation, there are multiple groups on Facebook that can help you. And we all live in a world of technology, so you can just reach out to the course coordinator on those groups. There are admins and course coordinators, just like I reached out to Dr. Pravin, and they will guide you through everything. So I did a course myself conducted by a doctor based in Australia. I was in New Zealand at that time, and it was a 1-month course, and they provided us with all the material we needed to study to clear the written exam. I myself dedicated 4 months to prepare for the written exam, and by 4 months I mean I did nothing else but study.
So how much percentage of people pass the first part 1?
It really depends every year for the cutoff of what they require in Australia for the dentists. When I did it, on an average, if 3,000 people are applying, at least 50% to 60% pass the written exam, maybe even more sometimes. Passing written exam is not difficult at all. If you prepare properly for 3 months, you need good 3 months preparation. You can clear the written examination, and then after that, clinical becomes a little bit more funneled, because you can only sit.
So explain the clinical. Is there like only mannequin, or do we have OSCE treatment planning sessions?
So there are treatment planning, OSCE, radiograph, LA, extraction, some other practical procedures, that they have to do. And ADC has changed. When I sat my exams, we had 13 tasks to do over 2 days, but now ADC has changed. In that time, they only conducted exam twice in a year. Now they conduct at least 3 to 4 times in a year, and they've changed the pattern of the exam. It's actually become more easier because you have multiple opportunities. So if you do proper, again for clinical exam, there are course providers in India also and in Australia also. For people in India, I would suggest, there is a course provider in Chandigarh, there is a course provider in Delhi, Bombay. You can see whichever is close to you. You can go to them, learn all the clinical techniques, and then go and give your exam in Australia. You don't need to go 3 months before giving your exam. You can prepare for exam in India, where you're living, where you're working, and then go maybe a week, 2 weeks before and give for your exams.
Okay, what is the life for a dentist in Australia? How good is that?
Look, if I've been in Australia for 15 years now. I've lived in New Zealand also, I've lived in Australia also. I still love India a lot, but there is better quality of life. The standard of dentistry is definitely much better than India. That people have more awareness about their oral health. So they do require dentists that are well trained, which is why the exams are so tough. I encourage everybody to come and at least explore it once.
On a note of discussion with her over a period, the salary scale is very higher, and the standard of living is also higher there. So you will get anywhere from 1.5 crores to 3 crores in a year if you convert it to the Indian rupees. Otherwise, you can say 300,000 Australian dollars to up to 600,000 Australian dollars. So though the entry is very difficult, life is better there because we have good climate compared to UK and also better prospects there. One more question, doctor. For going there as a hygienist or a therapist, so you said that we have to write the Australian Dental Council, same exam with mannequin and everything.
Yes, the only job as a dentist that you can do there, which doesn't require ADC, is dental assistant or any admin job or any other civil job. But hygiene, to work as a hygienist or to work as a therapist or to work as a dentist, you need to clear Australian Dental Council exam. You cannot do any patient-based procedure without clearing that exam. On a note from the salary side, I would like to add, a beginner in Australia earns even the most basic procedures, like you're a first year graduate, you earn at least 100k, which is 50 to 60 lakhs. Okay, so that is first, and people make more than that. This is just the base. I'm talking if you do nothing, just scale polish and filling, this is what you make.
Because there is a lot of scope for dentistry in abroad. That's why people are trying abroad. In India, we have too much of supply. We all have clinics. Every building has got dentists. But people are not coming here. There is a system where people come regularly for checkups. There is not a problem for money.
Yeah, I think it's not that we don't have a lot of surplus of dentists in Australia. There are a lot of dentists where I work as well. Like in my own clinic, we have at least 7 dentists. It is that the people are more aware. So, I don't have to convince somebody to come get a clean done. People know they need to maintain their teeth to enjoy a good life. So, I think that is the only difference. Here, even if you are a very good dentist, it is a big struggle to convince a patient, please let me do a clean for you. There, you don't need to convince them. They already know, They will come and say, sorry doctor, I couldn't come for 1 year, I had life issues, but I know I need a clean done. I don't even have to convince them. I just tell them, look at the x-ray, there is a decay, we need to fill it. That's it. That's all I need to do. I don't need to say, no, if you don't do a decay, they will be... Some people I have to, but 99% of the people are very self-aware, very motivated, which is why your life as a dentist is easier in that regard. But the protocols, procedures are very streamlined. We practice infection control to the highest standard. We have to be very patient-centric in Australia as a dentist. It is all about the patient. We do not treat them as guinea pigs. We treat them with a lot of respect. whatever walk of life they come from, whoever they are, whether they are a minister or somebody fixing a fan, they are all treated at the same level. There is no disparity. The money could be up and, more or less, but they're all treated at the same level of dentistry. So I wish you all the best. I hope you think about this.
So before we close this video, a quick feedback from the colleagues who are standing here, what they learned from Dr. Nisha's approach to the patients. First we'll start from you. Just simply you can say.
So I learned she's so sweet to the patients, everyone, and she's informed every concern about what she's going to done with the patient, and she's so confident. I love that actually from her as a female dentist. I love that, and she's so strong, and I love that. So she's done what the processes to the patients. I love everyone. And she's
Okay,
so
what is the one
confident.
thing she is doing which you are not doing? And you learned it from her.
Maybe confident, I think.
Okay, you have to be more confident.
So
That's good.
physically she's showing so much confidence to the patient. I think I will learn that.
Good. Okay, அப்படியே இங்க. Okay, Shalian, you can tell what did you learn from her? அவங்க கிட்ட இருந்து என்ன கத்துக்கிட்ட?
பேஷண்ட் ஃப்ரெண்ட்லியாக இருப்பாங்க சார்.
அங்க.
பேஷண்ட்ஸ் கிட்ட ரொம்ப ஃப்ரெண்ட்லியாக இருப்பாங்க.
Mike. She is very friendly with patients.
Yeah.
Then other than that, technically strong.
Yeah.
Like bodybuilders. What did you learn? What else you learned? She'll go happy. This is the real feedback.
So many things.
You're happy.
Yeah.
Any moments you can say, sir, this is the place I found okay. You're super confident. Abdi. Anywhere, any storyline.
அப்போல்லாம் பர்டிகுலராக இல்லை சார், ஓவராலாகவே.
Everywhere. Okay. Give it to her. Dr. Abhi. Hi.
Yeah, sir. Hi, sir.
You did your first implant yesterday.
Yeah, sir.
And you did your last implant yesterday. Okay. So you tell.
Yes, sir.
She is our guest. Okay. Last 10 days she is with us, and we are here for some time. So what did you learn from her, which you didn't know? Oh my God. Like what Ananshia said. Likewise, is there anything you want to tell?
She is very, very sweet to patients, sir. And in between, she asked like, "Are you okay, sir? Are you okay, ma'am?" That is so sweet to hear.
We don't care.
Not like that, but after sometimes she used to say repeatedly that is very sweet. And
What about her other attributes like confidence?
she is very confident.
Speed?
Her way of talking is very good to patient.
She will do that now.
Yeah, sir. Sure.
Dr. Ganesh.
Hello, sir.
She likes you a lot because you assisted her the best, and she wants to take you there.
No, I like everybody. All of them are very good.
Tell me, what did you learn from her?
She was doing very good job in the Malligai Dental for last 10 days, and I will learn everything from you. Seriously, no. About the she has great confidence about to handle the patients in a good way. I like that so much.
So you like that?
Yeah.
What else you like in her planning and approach and other things? Speed, accuracy. How was your experience yesterday after you saw her cases? So when you did your last case, any change you felt after her course? Did you feel any change?
She was going confidently and more. I take my much time from her, so I am doing one implant almost over 1 to 1.5 hours. But you had completed the case within half an hour to 45 minutes.
You know what? The reason for that is in Australia and UK and all, there'll be like 20-25 patients in a day. Every 20 minutes, half an hour, they have to see a patient. There is no time for talking, wasting time. To the point, talk, take the consent, start the work, and okay, any problem comes, explain the patient. Tooth broke, implant is broken, anything. Okay, anything can go wrong. Tell the patient, and tell how she will manage, okay, like referring the patient to a specialist or anything like that. So we want, as Malligai Dental Academy, we want all of you to raise your standards, okay. That's why this kind of exposure is very important, because we started in India, in our college or is our first exposure. Then this academy, when you interact with see, tomorrow if you don't know her, all this will be in your mind, right? Oh, this lady is so confident than me, this lady is doing very well. This is the starting point, that you have to start working more hard on yourself, that you have to work hard, study well. Because of our experience, it is like that. So you have to keep doing what you are doing, okay. Definitely at one point you will be confident, which others will tell. So even I was very scared, she was scared once upon a time. So don't stop doing things, keep working hard, okay, keep trying things. If you fail somewhere, learn why did you fail, don't blame others, okay, learn from your mistakes, okay. So as a thank you note, just take 2 feedbacks from them. The real feedback will come from this Rexia, which is now today Jailashmi. Rexia Jailashmi. Okay, please tell the feedback. What did you learn from ma'am? Ma'am கிட்ட இருந்து என்ன கத்துக்கிட்ட?
நல்லா ஸ்பீடாக பண்ணுவாங்க, டக்குன்னு பண்ணி முடிச்சிடுறாங்க, எல்லாத்தையும் ஹைஜீனிக்காக பார்க்குறாங்க. நம்ம ஏதாவது க்ளவ் போடலை அப்படின்னா நம்மள்ட்ட சொல்லுவாங்க இப்படி பண்ணணும்.
So she is telling that she is doing everything faster, and also she takes has a vigil on all of them, whether they are wearing glove, sterilization and everything.
பேஷண்ட் கிட்ட நல்லா புது பேஷண்ட் இருந்தாலுமே ஏற்கனவே பேசின மாதிரி பேசுவாங்க.
So you are talking to every new patient or the patient you are seeing for the first time that you have seen her before, like that. Like it was an acquaintance already for you.
அப்போ பேஷண்ட்லாம் பயப்படாமல் தைரியமாக இருப்பாங்க.
So the patients are not fearful or worried about the procedure, and they are having confidence on you.
ப்ரொசீஜர் ஸ்பீடாக பண்ணிடுவாங்க, பேஷண்ட்ஸ் கிட்ட பேசிக்கிட்டே எக்ஸ்பிளைன் பண்ணிட்டு பண்ணுவோம்.
So you are doing the procedure very fast, and you are talking and interacting with the patient throughout, so making the patient very confident. So thank you viewers for this lovely feedback video about Dr. Nisha and her approach. So I want all of you, those who are young, please have a goal to set your standards very higher. I know her also for a long time. She was my family friend. Her father and me, we worked together. When she was a student, I was working in the army. So from those days, I know her. She was very ambitious and very, very passionate about dentistry. So you guys have to develop that passion, develop that aspiration, to do something bigger. Okay, even right now also I feel I have to do much better. So that drive and ambition will push you much higher level. Okay, so don't limit yourself. That's what I want to say. Thank you so much, and please subscribe and comment to our channel. Thank you and God bless you.